So Morpheus8, if you've been following my page at all, you know it's my favorite treatment modality in aesthetics. It is probably the most well-known radiofrequency microneedling. What does that mean? So it combines microneedling, which is when we put tiny little punctate lesions, meaning tiny little pinpricks in your skin, combined with thermal energy or RF energy to basically tell your skin, hey, it's time to rebuild. It promotes more collagen growth, more elastin growth. It improves the tone, the texture of your skin. It allows you to target things like hyperpigmentation. It allows you to address things like acne scars. Like I said in many reels before, it is my favorite go-to procedure for every patient. Almost anybody at any stage in life, no matter what your skin concerns are, is a candidate for Morpheus when used the right way. So Morpheus can be used for skin conditions for a whole range of concerns and for age-related issues. So I guess the most common thing that we use it for are age-related changes, fine lines, wrinkles, increased laxity, loss of tone and texture, which again goes to the fact that with age you lose collagen, you lose elastin, your production of even things like hyaluronic acid starts to decrease. Morpheus comes in and kind of ramps up all of those things to kind of put your skin in a more youthful state. Things like hyperpigmentation, patients that are affected by what we call PIH, when you get those dark marks after having acne or having another procedure. Morpheus is great for treating hyperpigmentation. It gets those melanocytes, which are your pigment creating cells, to kind of behave and stop causing havoc on your skin. Patients that have other hyperpigmentation concerns like melasma, it's also a good treatment modality for that. We often combine those with topical treatments, with a chemical peel, but Morpheus is kind of the staple that gives your skin that reset. Even for patients that have had chronic acne and acne scarring, it's also a good modality. So for patients that have even been on Accutane, once you're no longer on Accutane and you want to address the overall condition, the overall aesthetic of your skin, Morpheus is a great adjunct. So from your 20s and beyond, Morpheus is a great modality. In general, it's a good tool to add into your portfolio for keeping your skin rejuvenated, for keeping your skin looking young, and for keeping all those other age-related concerns at bay. So we always recommend that Morpheus be done not as a single treatment, but as a series. And the reason for this is because what we're trying to do is get that scaffolding, the infrastructure of your face, to start rebuilding itself. You want that collagen to start improving. You want that elastin to start increasing. So neocollagenesis, which is the fancy word for that process where your skin makes new collagen, takes at least 4 to 6 weeks. So we recommend that everybody who's doing Morpheus for the first time schedule a package of at least 3 treatments separated by 4 to 6 weeks, but also gives your skin the time to do the work that the RF microneedling stimulates. So Morpheus comes into work, your skin is left to do the rest, and after about 2 to 3 sessions, you start to see tightness in your skin, maybe smaller pore size. You will see a noticeable glow. You will see less blemishes. Definitely will start addressing that hyperpigmentation. Everything that we do for you in the office is just the beginning. At the end of the day, maintenance, just like you do with your car, needs to be done at home. So even the best Morpheus done in the right way needs to be coupled with good skincare. The reason one of the 8,000 reasons I love Morpheus so much is because there's literally no downtime. One thing that we do at Illume MD is that we couple most of our Morpheus treatments with the utilization of exosomes. So not only is there very little downtime just with Morpheus by itself, but when we add exosomes, which bring in a very special regenerative quality that allows any of the inflammation, any of the redness that you would experience to go away more quickly, there's literally almost no downtime. I actually have to stop patients from putting on makeup the same day because they're just ready to go. So this is a great time of year to actually start Morpheus, and I'll tell you why. We're in Florida. Everyone spends their summers outdoors. There's a lot of sun exposure, and with fun in the sun comes sun damage. So right now, as the days are getting a little bit cooler, the days are getting a little bit shorter, it's a great time to start focusing on treating all of that sun damage. I would never recommend anybody do Morpheus the day of a special event. So when you're putting your turkey in the oven for Thanksgiving, it's not the day to come and get Morpheus. But a few days before, you'd be perfectly fine. Again, there's almost no downtime, but you never know if you're gonna be the rare patient that has a bruise or if you're gonna look a little bit more puffy than you'd like. Not a good time for a photo shoot on the day of, but a few days later, you're good to go.